So, Mrs. Frank, great to see you back. Last we spoke was about 7 or 8 months ago, and at that point we had placed you on a proton pump inhibitor for your reflux. Mm-hmm. You had about 6 months of therapy, if I remember correctly, so you've been off for a little while now. Mm-hmm. How are you doing?
I really felt better while I was on the PPI. I wasn't having any of the heartburn symptoms. I wasn't having any problems. And since I've been off it for the last couple months, I've just been having more pain and more symptoms, and I haven't really been happy with that.
Okay, I can understand. So the symptoms and the pain, what brings them on, and how often are they occurring?
It seems to happen a couple times a week, and usually in association with going out and having some drinks of wine, or going out to dinner and eating some spicy food, pasta or something like that as well. Okay.
And how have you been with ibuprofen or any of the other non-steroidal medications? I know you were taking some before.
I've been trying to take the acetaminophen instead, but the ibuprofen does seem to work a little bit better, so I've kind of been taking both.
Okay. So if I understand you correctly, you'd like to go back on the proton pump inhibitor because it worked so well for you. Mm-hmm. I have a little concern about that. I think that there are some risks associated with the long-term use of a proton pump inhibitor, and I'd rather avoid those.
What kind of risks are you talking about?
Well, there are some concerns that there can be an increase in bone fractures, and there are also some potential changes in your electrolytes or minerals that may be in your blood, and you may develop low magnesium levels. And there are also potentially some infections that could occur. Infections can occur in the colon, and that one that I'm concerned most about is something called Clostridia difficile, which can cause a lot of diarrhea. I think that there are some other options, and I think using less medication may provide a better quality of life for you and potentially avoid these potential risks. I think a prescription for an H2 receptor antagonist may benefit you. You may be able to take that when you anticipate having some of these symptoms, meaning if you're going to go out to dinner and have a red sauce or spicy food, or if you're going to have a glass of wine. That way, less medication may provide you with more and a better quality of life and also avoid these risks. Is that something that you'd be willing to try?
I guess we can try it. I wasn't aware of the risks associated with the PPI, but this sounds like it might be a better option, so we can give it a shot.
Yeah, I think it's a good option. And if we need to, we can always go back to the proton pump inhibitor after we've proven that the H2 receptor antagonist and some of the lifestyle changes aren't working for you. I'll also give you the sheet today, if that's okay, which reviews what we discussed last time as far as some anti-reflux precautions and also reviews reflux overall for you. Do you think your questions have been adequately addressed today?
Yeah, I think you've been very informative, and we'll give this new treatment a shot.
Great. I'll go ahead and get the prescription written for you, and then we'll also make sure at the checkout desk they provide you with a phone number to the office so that you can call either my nurse practitioner or I. Okay.
Okay.
Have a great day.
Thanks.